When do you do bypass surgery then?
Well, ideally, you'd like to never do bypass surgery. I mean, when a patient says to me, "Gee, should I have bypass or I have angioplasty, stents?" When do I decide to do a bypass? Most surgeons, and there's no controversy. It's not like a surgeon and a cardiologist are fighting for a case. If you come to St. Francis Hospital, the surgeons sometimes will say, "Hey, guys, why don't you do stenting? It's less risky." The surgeon doesn't want to have a complication. So clearly, there's less risk with angioplasty stenting versus bypass. What's the difference in hospitalization between the two? First of all, if you come in for a stent, you come in that morning, you may go home that night, you go home the next day, back to work the next day. That's great. The pain is minimal, maybe a little pain at the groin site, but it's really a minimal in terms of pain and discomfort, and you get back right away. Now, who wouldn't want to do that? I mean, it's like...
In comparison to...
Now, what's surgery? So surgery is I do the angiogram, and I look at the angiogram, and I say to you, you know what? I do angioplasty, but this is not going to work for you. It's not going to work long term. You're going to be back here in 3 months. I'm not going to get a great result. I'd love to do it for you, but it's not the right thing for you. The right thing is surgery.
What will show you that you won't get a good result?
When I
the
do
history?
The angiogram. When I do the angiogram, I can look at the anatomy of the arteries, and I can tell if the stent's going to work. So while I'm doing the angiogram, if I can fix you, I'll fix you right there with a stent.
Right.
Most people don't want to have surgery appropriately, but if you do need surgery, the statistics with that are really quite excellent. There's usually a 99% chance you're going to do fine with surgery, but it involves a surgeon making an incision down the middle of the chest. You have tubes coming out of the parts of your body you didn't know existed. You're in the hospital 5 to 7 days, and it takes a month before you can go back to work, and 3 months before you felt like you never had anything. So it's a much longer recovery. So ideally, technology is working to do non-invasive test procedures rather than open heart surgery.
Right.
But if you need it, it will fix you and is effective therapy.